Hello, my name is Selena Murphy. I'm going to talk with you about the future of incivility in the online classroom, specifically higher education nursing programs. The reason why I chose this topic is because I'm going to be a future nurse educator. I'm in the PhD of nursing program, and I feel this is a highly important issue. Incivility has increased along with the demand for online education. Faculties are seeking solutions to reduce online civility among students. And I gave some examples during the last presentation of what incivility is and how, unfortunately, incivility can escalate to even mental illness and possibly students harming faculty members and or vice versa. One of the recent articles I read was a nursing student failed two courses, walked on campus, killed all two instructors and his current instructor and two other fellow nursing students before killing himself. And there were really no telltale signs other than he was having personal problems at home, going through a divorce, and was having some trouble with courses in school, but there was no particular signal that he would actually bring a gun onto campus and kill fellow faculty and students. So this can escalate from stalking, verbal assault to actual physical assault. But also the importance of learning about incivility in the online classroom is that nursing students are going to be future nurses on nursing units taking care of patients, and patient safety is also at risk. Now, faculty are unprepared to handle incivility. When we go to school and master's or doctoral programs, we are taught how to teach our content. We are not taught how to deal with um, students that are disruptive in the course or how to handle this type of problem. One of the things we need to do is to acknowledge that there is a problem, that a student is being disruptive for whatever reason and not ignore the behavior. You want to address the behavior promptly by seeking assistance from your peers, from the faculty supervisor, from the local police or the campus police. And one of the things I've mentioned before, incivility in nursing education can filter on into a nurse on the job, and they can become nurse bullies or actually provide poor quality patient care. In the future, one of the strategies that has been suggested is peer education strategy, where senior nursing students will educate incoming nursing students on what behavior is acceptable in the classroom. There will be pre and post questionnaires, and there will be an active, reflective, and informal approach, this is, to discuss the policies of the institution. Like whether cell phones are allowed in class, what is the appropriate type of email to send, and when you should type in all caps and when not to, how the email should be addressed, and what is considered personal versus using the online chat rooms for asking a question. And there should be also a review of professional standards, whether there's standards from the ANA, American Nursing Association Code of Ethics, or whether there's standards from the local state board of nursing, and what the consequences are for violating different college policies. Will they be suspended or expelled from the program? Will the state nursing boards remove their license? People need to be aware that there are consequences for their actions, and need to be reminded of that. And as I said before, we have a peer education program. These are the type of things that they would do. They would review the policies, remind nurses they are responsible and liable for their actions, and that there are professional standards for nurses and what the consequences are. And the State Board of Nursing, some of them have review schools for probation and possible closure because of the action of their students. And they need to have evidence of what a positive student-faculty relationships are. So, for example, there was one school that was having a problem with their student, and the school was almost closed down by the State Board of Nursing because of this issue. And they had to prove that they were actually actively promoting positive relationships between students and faculty. Now, the Joint Commission is also a agency that provides accreditations for schools and for hospitals. And in 2009, they had what's called a Sentinel Alert, saying the behavior of healthcare professionals needs to be reviewed because it could impact patient care. Any type of discourteous or disruptive behavior by healthcare professionals can have a negative impact on patient safety, the quality of care provided, and result in employee dissatisfaction. And this could also be another reason why there's a high turnover rate of nurses in hospitals or nursing homes, and because of incivility in between. It could be in between employees, uh, different types, such as bullying, and this which is a big issue now. Now, one of the things that I think can also help with incivility in the classroom is that as a nurse, I belong to two different nurses associations. I belong to Sigma Theta Tau International Honor Society of Nursing for several years, and I belong to the Case Management Association. Oh, I'm also a member of National League of Nursing. I'm not actively as involved as I should. I know I should be more. I think with work and school going right now, it's kind of difficult, but I try to make as much time as possible. But all these nursing organizations I have listed, and of course there's more, all have some type of leadership accountability they would have for their nurses. They are promoting leadership. They're promoting social change, and all these nursing organizations, I think, if they would step up and take an active role in reducing bullying and incivility in the classroom, would go a long way to remind nurses they are professionals and they are responsible for their actions. Last presentation, I also talked about mental health issues that some students may have, and as I said before, as doctoral students, we are unprepared to teach. We are taught how to teach our course content. We may not specifically be taught how to deal with incivility in the classroom. And one of the things when I was reading the articles this week about the future of nursing education and civility is the first step is to trust your gut feelings. If you think a student is being disruptive in the class, they may have some type of issues or problems going on, you want to talk with the student along with your supervisor or other colleagues. And when you have the talk with other colleagues, have someone else, another faculty member, sit in a course with you to observe just that one student's behavior to determine maybe you know you are not seeing clearly. Basically getting a second opinion. Is a student really that disruptive in the course? Are they really an issue? And if so, take appropriate action as soon as possible. Refer the student to any counseling services they may have on the campus. A lot of campuses now have psychiatric services. And you also want to contact campus police and the local police as well. Sometimes the campus police may not be able to do as much as the local police, or there's certain rules want to involve the local police. So you really have to know what the rules are, jump ahead of this, and take action as soon as possible. In the end, incivility can affect nursing students, which will go out into their careers, and they can also become nurse bullies to other nurses. We always hear the saying, nurses eat their young, and that's why we really need to get ahead of this. And also, it can ultimately affect patient care and the quality of the patient receives. When nurses are dissatisfied with their job, they may not perform their job up to the standards. And I think state organizations, nursing organizations, to get involved to develop more leadership skills for nurses and let them know they are not alone, that they can also be leaders, and that what type of behavior is or is not acceptable. Thank you.